Okay, the third step in the examination of the abdomen is the percussion. Really, the percussion of the abdomen, we have to routinely percuss the liver as we performed just a few moments earlier, and you have to percuss the liver and then to percuss both sides at the midline of the abdomen, and then to percuss the suprapubic area for the presence of bladder distension or any pelvic mass or even uterine enlargement. So the liver percussion we have already discussed it. I'll talk about the percussion of the spleen. First of all, first sign, what we call the Castle sign, the lowermost intercostal space, just like this, at the anterior axillary line. Press here and ask the patient to take a deep breath and keep it inside his or her chest and percuss here. نفس نفس وحبسه بصدرك، حبسه بصدرك. If we have dullness here, this may suggest enlargement of the spleen. This is what we call it Castle sign, and both undergraduate and postgraduate candidates should know about this sign. Other signs for splenic percussion are really the Nixon methods and the Tropes method. Nixon method, I have to turn the patient toward me and I'll start okay. And I'll start percussion from the posterior axillary line downward till the dullness, and diagonally and perpendicular to the costal margin till anteriorly. And we have to check how much is the level of dullness from the costal margin to the upper border of dullness. Here it is just 6. More than 8, the dullness here, if it is more than 8, this suggests positive Nixon method and the presence of splenic enlargement. This is Nixon method. The third method, we have to percuss also from the mid-axillary line downward, here, downward, and then also we have to check the presence of any dullness here. Really, if the dullness from the 6th rib here, mid-clavicular line, to the left lower costal margin up to the mid-axillary line, this area we call it Tropes area. Dullness in this area while the patient is supine and slightly abducted his arm indicate the presence of splenic enlargement. Okay. After that, I'll check for the presence of ascites. The first method that I'll do it is a routine, whether the patient had an apparently distended abdomen or not. You have to check about this. This is about what we call it, this method is shifting dullness. I'll point my finger up to the face of the patient and I'll percuss from the midline to the left flank area. Then I'll ask the patient to turn himself to me. Here. I'll keep my finger there. If there are any fluid here, the fluid will gravitate downward and the colon will ascend up here, so the dullness here will transfer into resonant percussion note. If this happens, this suggests positive shifting dullness and indicates the presence of ascites. Just wait for a few seconds, about 30 to 60 seconds, and then percuss again. هسه ارجع لمكانك also till the midline. The midline here, it was tympanic till the left flank area, and when we ask the patient to turn himself, also it was tympanic till this area. So this patient had negative shifting dullness. In case of ascites, we have also to start from the midline up to the right flank, up to the left flank area. Here, in case of ascites, there must be an area of tympanic, always it's present here. You percuss here till you descend down up to the left flank area. The percussion note here will be dull, and while you ask the patient to turn himself into the right lateral position, the percussion note here will transfer from dullness into resonant, which is a positive. After that, you have also to repeat the maneuver here and also ask the patient to turn himself. This maneuver, we call it shifting dullness. So it is routine whether the patient had abdominal distension. Apparently there is abdominal distension or not. You have to percuss this abdomen from midline into both areas as I performed now. If the patient had positive shifting dullness, we have to perform another maneuver for ascites, which is what we call it the transmitting through. بس حماد اديك ايدك هيك تضغط له هنا على بطنك. حلو اضغط. I'll ask for assistance to press to his abdomen to dampen any transmitted thrill in the abdominal fat, and then I'll put my hand palmar surface here and I'll flick the abdomen here. Okay, عشت ايدك. Flick the abdomen here. Any transmitted thrill indicate the presence of a fluid inside the cavity. This fluid is under tension. Really, shifting dullness is more sensitive than the transmitting thrill in deciding whether or not the patient had ascites. After that, I'll check for the presence of bladder distension or pelvic distension or pregnancy. All of these will result in dullness percussion note if we percuss the bladder in such a manner. Really, these points are all about the percussion of the abdomen, and the next step will be auscultation of the abdomen.